So I was just telling you about that. You need to reassure by giving some information that let me tell you that how do we generally handle patients uh, with depression who come to us, and we assess them and we see whether they need medication or not. Okay. And if they need medication, then we prescribe medications, and we also refer them for counseling sessions, that is talking therapy. And we also give them some card which we call as crisis card, on which names and number of the persons have been written, uh, who need to be contacted in case of emergency. Okay. So you need to tell about general management, but you cannot give any particular information about the patient or the daughter. Okay. So this is this scenario. It's all for this scenario. Let's move on to the next scenario. Cancer talk with the surgeon's son. Okay, now you are FY2 in surgery. Patient is Mrs. Markle James, a 70 years old lady who was admitted from a nursing home with weight loss. She had a CT scan of the abdomen which showed suspicion of malignancy of large colon. Talk to the son and address his concerns. Okay, unless, see, it is written here, unless scenario states consent taken, assume it has not been taken. Unless scenario states patient doesn't have mental capacity, assume patient has mental capacity. Okay, so you have to assume that no consent has been taken and patient has the mental capacity. So let me tell you what scenario is this. Basically, this is a scenario where a surgeon's son, okay, the son is a surgeon. He works in another hospital, and he has been informed by one of the nurses or staff that his mother had a CT scan of abdomen, and it suggests some malignancy, or it has some findings. So the surgeon himself is suspecting a malignancy because his mother has been losing weight over time. So he has now come and he is here to talk to you. So you have to talk to him. So tip for this scenario is that you have to just dig out information, but do not give information. You can give general information. Do not give particular information about the patient. And you have to address the person, the doctor, because he's a consultant. He's a consultant surgeon. So you have to address him as Mr. Okay, this is the tip for this scenario, that you have to address him with respect. In UK, whenever you want to give respect to some person, you address him as Mr. For example, he is James. So you have to say he's Dr. James. You don't need to say Dr. James. You just can say Mr. James. Okay, because it's understood you both are of the same profession. So you would be saying Mr. James. Okay, so let's see. Here, it would be, let me tell you about the setting, that when you walk in, he might be standing and he might be moving around in the room, in the cubicle. And when you enter, and he might do the grips. Instead of you doing the grips, he might be doing the grips that, okay, are you the junior doctor who's looking after my mom? So then you will be starting with type 2 introduction, that, okay, pardon, I beg your pardon. I'm sorry. Can I check a few details before we talk about your mom? By the way, I'm Dr. Smith, one of the doctors working in this department. Can I ask your name, please? And refer to him as Mr. Okay? He will be telling you that I'm Dr. John Smith. You will be referring him to as Mr. Smith. Okay? Since he's a surgeon. So, hello, nice to meet you. And can you please tell me your mom's name, and then check for the details of the mom? Okay. And would you like to have a seat, please? He would say, no, I'm fine. If he doesn't want to sit, then keep on standing, and you have to talk in standing position. If he sits, if he takes a seat, then you have to sit as well. Okay. And then you will ask, okay, what can I do for you? So he will be telling you, because he already knows about the scan, so he will be asking you that, okay, can you tell me about the scan? And then you will ask that, okay, we will be discussing about your mom's condition, but I need to ask you a few questions. And can you tell me that what scan are you talking about, and how did you get to know about the scan? Okay, what do you know about the scan? And then he would say that I know that she had a scan of abdomen, chest, and pelvis. So you would be asking, okay, so how did you know about it? And he might tell you or he might not tell you. And then you would ask that, do you have any concerns? Why did they do the scan for your mom? And then I would like to ask you a few questions about your mom's condition, and then start asking about medical history, any medications history, any allergies, past surgical, past medical history, all those histories, okay? And then ask for any similar scans or similar investigations done in the past. And then ask about social history, that okay, I understand your mom is in the nursing home, because it has been given in the scenario. This lady was admitted from nursing home. So you need to ask that what is the reason for her to be in nursing home. Can I please ask you, are you the next of the kin? Have do you have any other siblings? What about your father? Okay, has your mom appointed you or anyone else as her lasting power of attorney? Okay, you have to collect all that information, but you don't give any information. Basically, you have to dig out the information, but you don't have to give the information. And then you will be saying that okay, you will be replying politely and use eve protocol, that I can see that you are a bit concerned and worried about your mom. I'm really sorry to hear about your mom, but unfortunately I have got a little bit of problem. The problem is that I didn't take permission from your mom in order to speak to anyone about her condition at the moment. I'm not sure whether she has the capacity right now. So I'm also not really sure whether she has given consent to speak to any of her family members, okay, regarding her medical condition or treatment options. And I'm sure you will clearly understand it because you belong to the similar profession as well, and we have to maintain the confidentiality of the patient. Okay, so I just only need to take permission from your mom as a part of our formalities to avoid breaking confidentiality. Okay, you can talk to him like that. And I'm really sorry. You can again apologize. I'm really sorry. I know that it is very important for you to know about your mom's treatment and her condition, but I hope that you clearly understand that my hands are tied. Okay. So then what you need to do is you have to offer the solution as well at the end. It's not the solution. You have just refused the patient's attendant that, okay, I'm not giving you information. You have to tell, okay, if is it okay if I can, if you can leave your number with me, and I can go take permission from your mom, and I can update you on her condition after speaking to your mom. Okay. And then he might agree. He might say, okay, all right, I understand. And then random chit chat may begin, and he will be sitting and he might ask you about rotations and just to spend the time. Okay. And then the bell will be ringing and you will have to leave the cubicle. All right, that's all for this scenario. And there might be some questions from examiner side. Okay, here in this scenario, there could be some possible questions from examiner side. The examiner might ask you that, okay, what are you going to do now? What will you do next? So you will tell the examiner that the first thing that I'm going to do is I'm going to speak to the patient and check her capacity. How would you check? You will be asking four things: that how does she understand? Okay, does she understand? And does she does she understand? Does she retain the information? Does she contemplate the information? And does she reply back? Does she communicate with you? You will be assessing confidential this capacity. Okay, you will tell that, okay, the very first thing I will be doing is I will be going to speak to the patient, and after I have spoken to her, I have assessed her capacity, I'll take consent from her, and then I'll update the colleague, that the surgeon's son. Okay, And the other thing I'm going to do is I'm going to inform my senior about this, that this has happened. Somebody uh, who asked somebody who claimed to be the patient's son has come today, and he has asked about her, and I will document it. I will inform my seniors, document it, and ultimately I will inform everyone about it. Okay, this is all for this scenario. So that's all for the scenario. Cancer talk with the surgeon's son, and then these are two easy scenarios. We are going to discuss them like very quick. We are going to discuss them in the same scenarios, same continuation of the scenarios. You can see its capacity, because these are the real life scenarios. These sort of scenarios you get over there, apart from the stations, in the real life as well. In NHS, when you will be working in the NHS, you will be getting these scenarios. So these scenarios are there. So let's discuss these scenarios, and then we can leave this contraception in minors approach to the next session. Okay, let's discuss these two scenarios. Let's finish them up. So it's about capacity, that colonic cancer, don't tell my mom or dad. Okay, there is one scenario. Scenario A states that you are FY2 in medical unit. Mr. Ali is a 67 years old man who was admitted with abdominal pain and diagnosed with colonic cancer. Other information: at the time of initial assessment, Mr. Ali was confused, and the consultant had discussed his condition with his son Muhammad Ali. Today, his daughter Sara Ali is here. She would like to talk to a doctor about her dad's condition. At the moment, Mr. Ali is well and mentally capable, means he is having capacity. Talk to the daughter Sara Ali. Permission from patient has been taken to talk to his daughter. So the consent has been given, and patient has the capacity. And this is the scenario where the patient has the, if the patient has the capacity, patient has the right to know about his treatment. Okay. So patient autonomy, principle of autonomy, that patient has the right to know, and patient has the right to decide whether he wants the treatment or he wants to refuse the treatment. Principle of autonomy. So the scenario B says that you are FY2 in surgical unit. Your patient is Laura Parkinson, who is a 67-year-old who was admitted to the hospital with tiredness. She had a CT scan which shows multiple metastases in the kidney, liver, and lungs. 10 years ago, she was diagnosed with colonic cancer, and now she is presented with metastasis. She was treated successfully and declared cancer-free for the last 10 years. Today, her son is here, and he would like to speak to one of the doctors about mother's condition. One of your colleagues has told him about the mother's condition because the patient has given permission to talk to her family. Talk to the son, address his concerns. Patient has mental capacity, so patient needs to know everything. You have to tell them everything, fully disclose the information to the patient. You can't hold back. This is the tip in those scenarios. Okay, if you get such scenario, so the tip for this scenario is that you have to give information to the patient. You have to give this information. You have to discuss their condition. The patient has the right to know about their condition, their diagnosis, their treatment, their investigations. Okay, so patient autonomy. And because they have capacity, and if they didn't have capacity, then the next person deciding would be lasting power of attorney, the family members, or if nobody is there, then the doctor themselves. Okay, so let's discuss those scenarios. Both are similar scenarios. I will be discussing both of them. If there are any concerns in those scenarios, I will be addressing those concerns. Okay, so that you should know it. So first of all, what you will be doing is you need to confirm that, do the grips, confirm the relationship, and ask that, okay, paraphrase the scenario, that I understand that you have some concerns or you would like to speak to one of the doctors. Anything in particular you would like to talk, or anything you would, in particular, you would like to know about your mom's condition, all that. Okay, you have to ask this. And then son would say that, doctor, I hope you haven't told my mom that she has got cancer. So doctor would be saying that we have not spoken to your mom yet, but is there any particular reason why you don't want your mom, why you want to know that whether your mom has been told about her condition or not? Why you want to know about it? So the son would say that I don't want you to tell my mom about her condition. You will be asking that, okay, here comes a principle that you need to be honest, you need to tell the truth. Okay, you can only withhold, there's a tip that you can only withhold information from the patient temporarily when the particular information can cause immediate harm to the patient. Okay, are you getting me? If there is immediate harm to the patient's health, you can temporarily hold this grave, or you can hold such information from the patient. For example, the patient has got cancer. Okay, the patient is already the patient has already gone through a major trauma, such as MI, for example. Recently, she has undergone MI 5 days or 10 days ago or a month ago, and she has been diagnosed with colonic cancer as well. And you will be holding this information. You can hold it, because if telling this information, or if somebody close to that patient has recently died, for example, her husband has died, and she has not been out of that trauma so far, so you can temporarily hold it, because she won't be able to bear this information. So that's why you can hold this information temporarily, but you can't hold it for longer period of time. Okay, so uh, you will be, as a doctor, your reply should be that sometimes it may be necessary not to tell and someone what's wrong with them, what's happening with them, any particular reason you don't want your mom to know about her condition. And the son might tell you, doctor, she won't handle it properly. uh, okay, tell me, why would you say that she won't handle it properly? Any particular reason for saying that? Why do you feel that that way? And did something happen? You need to explore. Why does the son not want her mom to know about her condition? So the son would say that, actually, doctor, my dad died of cancer last year. So she went through a lot, struggled to cope up with it. And she believes if you have cancer, it means you are dead. So here is a concern, and it's a valid concern of son. And you have to use Eve protocol over here, that I'm really sorry to hear about your father. Now I clearly understand that why are you not in favor of telling your mom about her diagnosis. Okay, uh, most people in your situation may be concerned, and I know why you are concerned, but let me explain to you some of the challenges that we might face if we do not disclose, or if we do not tell your mom about her diagnosis. For example, uh, at the moment, your mom is having capacity, that is, she can understand the information well, and she can make decisions for herself. So her condition, later on her condition might deteriorate, and she might not be able to understand the information, and she might not be able to make decision for her. So we won't be able to tell her about her condition properly. And the second thing is that without telling her, we need to run some tests, some investigations. There could be some invasive investigations as well, like taking biopsies, and non-invasive, such as doing a CT scan or MRI, and doing endoscopies, colonoscopies, taking biopsies. So we cannot perform these investigation unless the patient knows about it. Okay, so we need to tell your mom about it. So we cannot hide this information. We can temporarily withhold this information, but we cannot hide it. Okay, and the patient son might say that, so doctor, why don't you tell her that she has got tumor? Why don't why don't you tell her that she's got tumor? And please do not use the term cancer. Okay, so again, you have to tell the son that well, everyone understands the term cancer, and if you don't tell her that she has got cancer, first of all, she might not understand the seriousness of the condition. and it can cause confusion. And in addition to that, we may not be able to give her proper treatment, that is, might be chemotherapy or surgery. So we may not be able to give her proper treatment. She may not she may not understand the seriousness of the disease. Okay. And same, we cannot go for biopsies or invasive procedures. You can say that. And also you can say that some of the treatment, if we give her a treatment like chemotherapy and it has got some long-term side effects as well, and she may not be aware of this, and we may not be able to explain her properly about the treatment. So you need to tell all those things. And the son might say that, okay, doctor, in my culture, what happens is that the eldest son takes the decision for family, and I'm the eldest son, so I take all the responsibility, because my mom approaches me always if she wants to discuss anything. So don't worry about it, just treat her and I'll take the responsibility. So you have to, what you have to do is, you will be saying that, okay, I'm glad to hear that, and it's good that you are taking so much responsibility. Thank you for your support. Well, at the moment, your mom is capable of understanding and able to make her own decisions. So in this situation, we are supposed to tell you. Okay. And can I ask you, are you the next of the kin? Anyone else involved in your mom's treatment? Okay. And then ask about any lasting power of attorney. Has your mom appointed anyone as lasting power of attorney? Okay. And has she made any advanced directives? Okay. Or a living, does she have any advanced care plans or any living will? Okay. You know what is an advanced directive? Basically, it is something that a person documents, that what type of treatment they would like to be given in future if they lose the capacity. Okay. And what are their wishes, where they would like to die, what are their wishes towards the end of the life if their conditions become worse and they are not able to make their own decisions. And lasting power of attorney is the person who makes decision on behalf of another person. It could be son, it could be daughter, it could be husband, it could be a friend as well, or a relative as well. Anybody could be lasting power of attorney. Okay. And they are legally appointed. And advanced directive is also, it is also written, a written document. Okay. It's a legal document. Bear in mind. And the next thing is, you can offer tell give reassurance to the this son. Tell that, okay, don't worry, this will be done properly, your mom will be offered support, and we have got a team of experts over here, they will handle her in a very sensitive way. Then after discussing with her, we will also check how is she coping, so we will be supporting her throughout. And what we can do is, when we have this discussion, if your mom is okay with it, you can accompany her, to provide support to her. Is that something that you would want? Okay. So this would be things that you would reassure him. So he would be very happy. He would be saying, yes, doctor, that's fine. I would like to be present by my mom's side. That's fine. And then you will tell, okay, fine, okay, great, then in that case we will speak to your mom, and we will, after speaking to her, you can be present there, and uh, we will be disclosing this to your mom. And thank you for sharing your family's story. I'll also speak to my seniors. Is there anything else I can do for you? This is for this. Okay. And the similar situation, similar scenario, scenario B is FY2 in the surgical unit with patient Laura Parkinson. And none of the mother has told him about muscular. Yes, both the scenarios will have almost similar approach. Okay. In one is Mr. Ali and other is Laura Parkinson's. And Mr. Ali has also got colonic cancer, and this patient, Laura Parkinson, has also got colonic cancer. Okay, so same approach will be used. And now let's discuss the last scenario for tonight, sorry. Start discussion with son. Okay. There are two scenarios again. Both have the same, in which in one scenario, the son knows what has been done for the mom. And in other scenario, the son doesn't know what has been done for the mom. You have to tell that what has been done so far for the mom. Okay. So you are FY2 in acute medical unit. Leslie Brown is an 80-year-old female who presented to the hospital with a fall. After Leslie Brown fell down at home and came to the hospital on her own, she fell down and sustained fracture of her wrist of non-dominant hand, that is left hand. She has been seen by the orthopedic team who have put her arm in the plaster cast, and they have arranged follow-up in a fracture clinic in 1 week time. She was admitted to the observation ward and reviewed by the physiotherapist and occupational therapist who recommend her to use a walking stick, and as well she was referred to the social services who offered her carers to be coming every day, twice a day. Patient is mentally well and capable to understand the information. Okay. Full blood count, urea, creatinine, electrolytes have been done. LFTs, glucose, CT scan of the head were normal. Patient is ready to be discharged home. Please talk to her son, Adam Brown, and address his concern. Permission from the patient has been taken. Permission from the patient has been taken to talk to his son. And son will ask you not to send mother. He will be trying to take decisions on his mom's behalf. Okay, because the scenario says that mother has the capacity, and despite that, son is trying to take decisions for her. So you would be uh, giving preference to the mother's decision and not the son's decision. Okay, so here you have been provided the setting and also the management that has been done so far, that she has been reviewed by the orthopedic team. What did they do? They did a plastic POP cast and review in 2 weeks time. And also she has been referred to social services and they provided her with carers. All has been done. And she has been advised to walk around with crutches or stick or whatever. And then you have to tell about this treatment and what has been done. You have to tell the son about it. Okay. So number one scenario is the son is not aware about what has been done for his mom, and also does not know that she has sustained a fracture of her hand. So you have to you have to tell this information in a sensitive way, because it is a sort of you will a sort of rather it's a bad news, breaking a bad news, that you will be, so you need to be sensitive. It is not completely a breaking a bad news, but it is a scenario of capacity, mental capacity, and disclosing and uh, what you say is you respect the patient's decision over here. You prefer the patient's decision. And scenario B is, you know what, that that mom has come with a fall and she has got fracture, and what has been done, and he's still not happy, and he wants he wants his mom to go to this nursing home, because his mom will be alone at home and there could be a risk of falling at home again, and she will be in a good company in nursing home. That's why he wants his mom to go to nursing home. So let's see how to crack this scenario. So you need to start by doing grips, be loud, confident, smiling, maintain eye contact, or if possible, shake hand. But we do not normally shake hand in PLAB 2 scenarios, okay? And confirm relationship to the patient, know the name of the patient. After you have taken the details of that son, you have to confirm the relationship, take the details of the patient as well, and paraphrase the scenario and check his understanding. What does he know so far? Explain everything that has been done and tell him that unfortunately 1 year mom was brought here and she sustained a fracture of her left wrist. And then give a slight pause for the son to take this information, and then explain that and then say that I'm sorry to inform you that your mom has sustained a fracture of his left wrist, and then pause and then explain what has been done, how has she been managed if he does not know. Okay. And then you can tell about the investigation that were done, the review by the physiotherapist, who are the mobility physiotherapist, and who are the mobility specialist, occupational therapist, and also reviewed by this orthopedic team as well. Okay, and then you need to basically dig out history, past history, and the reason for past history, and dig out any risk factors that could lead to falling, or that could increase her risk of falling at home. You need to take out by taking a detailed history, that is past medical history, PMA, Holy Family, and Desert Holy, and that acronym or mnemonic you have to remember, and take that history, particularly about any past such experiences, past medical, past surgical, any medications, allergies, who does she live with, assess for living condition, who takes care of your mom, does she live alone, all those things. Okay, and tell about the management, that your mom has been reviewed by the physiotherapist and occupational therapist, that are the mobility specialists, and then explain what they have done, that they have advised her to move around with stick, and orthopedic team, they have put a plaster cast over it, and they have said that the review in 2 weeks time it will heal. And also she has been provided with social services, who will be providing him carer to visit twice a day, and she has sustained a fracture of non-dominant hand, so she would be able to carry out her activities with her right hand, and she has a low risk of falling if she goes home. Okay, and then uh, as you have taken all the history, you have explained everything, but the son would say that, doctor, I want my mom to go to the nursing home, and you will be asking that, it's ultimately, the son would say, don't discharge her, rather send her to nursing home. Then you would say that it's ultimately his mom's decision, and we have already talked to her, and she wants to go home because she is medically fit, and she is fit to be discharged home, so it's her decision. And we feel that nursing home is not necessary at the moment. She can do well with the carers and all those support that has been provided. And carers would be visiting twice a day, and if necessary, they would be visiting 4 times a day. Okay, and we will be following up regularly. The team will be assessing her at regular intervals, and nursing home may be required in future, but at the moment she is doing well, and she won't benefit, and wherever she lives, whether it's nursing home or she goes to home, she might be having she is having a low risk of falling because she lives alone. That's why she has been provided with carer support. Okay, and he might also tell you that, doctor, um, uh, why are you not sending? Then tell her that she has the mental capacity and she has the autonomy to decide. Okay, we can't decide for her at the moment. She has got mental capacity to decide, to understand what's happening, and wherever she wants to be in this situation, no one can force her to go anywhere. The decision has to be made or to be taken by your mom. And son asks, if you ask her, she will go. If son is asking us to ask his mom to go to nursing home, but we would say that we don't think that it is necessary at the moment. Me and my sister live far away, son is saying that. You need to tell that we are not expecting you to visit your mom every day. You can visit whenever you want. If you are worried, keep in touch with the carers and the GP can update you. Son would say, I don't think that you have done much for my mom. So you should say that, I understand that you're not happy, but we feel we have done the right things. This is the best thing for your mom. We feel that she is going to be fine. Okay. And that's all for tonight.